Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.
Hello and welcome everyone to Daily with Doc and Becca. My name is Ruth Ellen Sanchez and I'm going to be hosting today. And I want to let you know that we have a very special guest today, William Tim Marsh, who has been on before with a really interesting topic. And also this program is not meant to treat, diagnose, or cure or prevent any diseases. It's not intended to take the place of your primary care physician. No, oh my goodness. I cannot do that. All right. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences of the individual. Results may vary and it may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options. Thank you. All right. If somebody referred you to this program, please make sure to get back to them as they are going to be your primary contact. All right. So today we have Tim, and I'm just going to go ahead and bring him up with me. And we are going to get to know him a little bit, and then he's going to tell us some really amazing things.
Mm.
So, Tim, tell us a little bit about yourself.
Well, my name's Tim Marsh. I've been a body worker, deep tissue pain trauma specialist for the last 27 years. And I guess you could say I'm pretty good at what I do, but um, I wanted to be able to have this
Mhm.
talk about how your body remembers the hidden cost of trauma and how it embeds itself into the chakra system.
I'm really looking forward to hearing about that because I have experienced this myself. So, I'm going to let you just go ahead and get started.
Okay.
Okay.
Um,
And I'll bring,
everybody's heard of chakras, but this is going to be the darker side of chakras. This is going to be the side that we may have had understanding with, but what I want to do is I want to pull it out of the Reiki session from the person laying on the table, and I want you to be able to start to decipher it on yourself instead of having somebody do it for you. I mean, I'm a Reiki master. I love working with people, but I also love the fact when Reiki masters or Reiki practitioners are able to pull stuff out of people, but then they keep going deeper on their own instead of relying on us just to keep being the one that keeps opening up the door or propping up the door. And the person wants it closed. So anyway, I just want to say this is not a teaching. It's a sharing. It's a conversation between your body's story and the deeper truth that you've had for a long time. That your pain has a place, your body's hiding it for you, and that every chakra carries a piece of that memory. So let's begin at the root. So we all know the root chakra is chakra number one. And if you look at the chakras, it's like a ladder, it goes up. So it starts at the sacrum and goes all the way up. So some people could say that the lower chakra is the bowels of hell, and some people can say the higher chakra is heaven. You could say that heaven and hell is built into you. So if we have trauma that hits us really hard, childhood trauma, stuff like that, we stay in our guts, we stay in the lower level vibrations. And sometimes some of us don't make it out. We get stuck in there for a very long time. So when you start talking about the root chakra, you're talking about the color red. So the theme is safety, survival, stability, and belonging. Now, notice that last word, belonging. So there's so many of us that were raised by parents or were raised by a tribe, and we just don't feel like safe. We feel unstable. We feel disconnected from our body and our surroundings. And we're also hypervigilant, anxious, and ungrounded because we don't feel safe. So when you start talking about the types of traumas that are stored in this area, you're talking about childhood neglect, you're talking about unsafe home, instability, and homelessness. So you can start to see that a lot of us feeling like we don't belong, or that could also be in a job setting. You could be in a job and you're just like, you know what, I just don't dig this anymore. I don't resonate with these people. And then what happens is you start to not be happy. And then the the trauma stored, and then you start getting into the physical symptoms like lower back pain, constipation, sciatica, fatigue, and panic. So you can see that these chakras are just not little rainbows and puppy dog channels that have energy. They store the energy that happens to us. So, like with my history, I I had a man on my table once who moved 26 different times before he was 12 years old. And he felt like his body was never grounded. And then once we started to process these different moves and process how he didn't feel safe and neglected, and because he had no stability, it was no wonder why the man also had 5 divorces, and he couldn't feel safe. So what we did is we worked on his lower chakra and released it and helped him. So before I move on to the next chakra, does anybody have any questions? I don't want to just keep rambling.
I do not see any questions as of yet, but for those
Okay.
of you that are here live with us, please raise your hand as soon as you have a question so that we can make sure to get it answered. Thank you. And I will check the platforms and I'll let you know. Thank you. Keep going. This
Okay.
is great.
So the second chakra is our sacral chakra, and that color is orange. So what's really interesting is if you look at the chakras, you look at the sacrum bone and then you look at the pelvis that it plugs into. Well, the sacral bone is the masculine energy and the pelvis is the feminine energy. And there's so many people walking around with issues like tipped SI joints or rotated different lumbar spine and stuff like that. And that that chakra has to deal with emotions and creativity and sexuality and pleasure. And the the dysfunctions, the things that tell you that that chakra is locked up, is emotional numbness, shame around pleasure, and disconnected from desire. And that one's probably one of the most interesting ones to work with, because the traumas that like to get stored or tucked into that sacrum are sexual abuse, emotional suppression, and a big one that I come across a lot is body shame. It's people who are ashamed of their bodies. And the physical symptoms are pelvic or hip pain, reproductive tension, and emotional stagnation. And an example of that is I worked with a woman that was shut down by childhood trauma, and this was a powerful time. She was abducted into a um, a a gang group when she was 5, and she wasn't able to get out until she was 12. And let's just say she had a very difficult time with relating to the world and people in general. And when I worked with her, I was able to open up this chakra, and I got her to start realizing the reason that she was harming herself and she was body shaming and she wanted to please everybody was because she had this disconnection from her um, desire and her happiness. And her happiness came from the fact that she wanted everybody's um, life to be good, so she felt safe. Now, that was my life for a very long time growing up because I experienced trauma. And I realized that I suffered plumber's syndrome. Everybody's pipes are fine except mine because I wanted to make people happy. And that's people-pleasing behavior. And really the reason we do it a lot of times is because we're trying to make sure our environment stays safe instead of happiness. So we shut down our words or our thoughts and our actions, and we swallow our tongue, and we don't know how to speak up for ourselves. We don't have boundaries. And so you can see how the second chakra is really, really linked to a lot of people who have people pleasing personalities, or what I call, you just give control to the other person so you feel safe, but really deep down inside, you're a prisoner. Any questions, or you want to keep going?
Well, I want to unpack a few of those things, maybe.
Okay, cool.
Oh, Marilyn has a question. Marilyn, go ahead first.
Yeah, I just wanted to know what's the procedure you do for each of these things? Is it massage?
It's a kind of version of Reiki massage, Reiki deep tissue, Reiki PTSD. There's so many different styles of Reiki out there, and we're all trying to do the same thing. But sometimes when you get a Reiki practitioner that is peace, love, and happiness, right? Like this, the granola kind of style, or just the flower child kind of. A lot of times they try to get into these places, but they're not tuned in, tapped in, or turned on to what trauma is, because they've had a couple of situations that happened. But then when you have people like me and others who are really traumatized by the time we're 5, we're able to tap into that frequency that other people can't. So I don't have a set way. It's just me showing up and reading and listening to their body. But I'm a different Reiki practitioner. I like to touch people, and sometimes in traditional Reiki style, the hands are above. I'm a Taurus. I like to get my hooves in the ground, so that's why I like to dig stuff out.
So can you feel a lack of energy, too much energy,
That's a
or
good question.
something tense?
I feel it in my body. My body is the divining rod. I feel my gut twist. I I feel the person's pain. I may even have a glimpse of what happened to them. It's deep stuff, but I part of my reason for doing this show is to show people how they can dive in and just touch themselves. Like they can lay on the floor and they can touch their stomach, and they keep a journal or a video journal, and your body will give it up. Your body will give you the signal. It's just sometimes we're not quiet enough to hear
Excellent. Thank you.
it. Mhm.
Thank you, Marilyn. Here's spotlight away. There we go. Oh, excuse me. Okay, Dave, who's out there on YouTube. Hi, Dave.
Hey, Dave.
He says, or he asks, what's the best exercise for the chakras?
Mm. Well, I'm going to be biased because I'm a former yoga instructor. I think yoga is one of the best forms of exercise, because every time you get yourself into a different position, that's aligning your chakras to be aware. But I don't know if there's one particular exercise, because I don't like fudge ice cream, but other people like it. My advice to you is, if it motivates you, if it makes you feel good, if it makes you feel happy, then you found the vehicle that you can start to use to help you. So when I was a personal trainer, I used to run on the treadmill, and I used to run and have what's called soul sweats, and I sweated like crazy. And during that process, I kept a journal, and I kept writing all this stuff that popped into my head, and it was allowing me to use my exercise, not to exercise my body, but to exercise my demons, my past demons, the past junk that happened to me.
Mhm.
So, you know, Dave, I can't give you a specific exercise, but I will tell you a lot of times if you get out of your comfort zone and if you're used to running on the treadmill, if you get outside and you just walk, sometimes just changing that environment will help you process to a different level.
Yeah, I agree with that. Especially if you're out there walking, Dave, and you just pay attention to nature and enjoy the beauty of it, a lot of things just kind of shift. At least that's the way it is for me.
Yeah.
Yeah.
Oh, let me add just one more thing. Hey, Dave, um, sometimes when we do exercises, let's call that fire, like weightlifting and stuff like that. A lot of times when we're doing those fire exercises, like high intensity training or, marathon training, all that stuff, that's active. And sometimes if we do things like water, like Tai Chi, yoga, um, very, very slow forms of yoga, like Hatha yoga, or even just stretching by ourselves, we quiet our monkey minds so then our body can start talking to us. So hopefully that helps.
Right. Very good. You can keep going because they kind of talked about what I was going to talk about.
Oh, okay.
Yeah.
All right. So the next chakra is the solar plexus chakra. That's the one where our willpower, that's the one that we have our confidence and our identity, and the color's yellow. The block dysfunction is low self-esteem, fear of being seen, and doubting self-worth. So this one was a big one of mine for a long time until I started to realize that, my self-worth was tied into what I was taught by dysfunctional individuals. So then essentially what I was doing was keeping their poison in my body. And I'll be honest, it took me a long time. I'm 57 years old, and I probably say within the last 2 years, I've been the happiest I've ever been, because what I did is I did all the work that I'm talking to you about. I went through every little chakra and cleaned it up. And that's why I'm in front of you, because I used to have a fear of being seen. And now I'm out there and I'm dealing with it. But anyway, getting back on track. Traumas stored are bullying, humiliation, controlling, and controlling environments. So there's a lot of people out there who they want to try to control the environment, and they want to try to keep themselves safe. But realistically, the only thing you can control is from your fingertips back. You can't control the outside world. There's no control there. So focus on your thoughts, focus on your actions, and understand if your environment is toxic or if it's in a bad place. You may not be able to control that, but you can control your thoughts and actions. And that's pretty much that's a big one. But a lot of people are coming to us with the physical symptoms of this, which is digestive issues and ulcers and shallow breathing and mid back pains. So when you start looking at the um, the chakra, you start looking at the solar plexus. Well, in that area is our diaphragm. So if we're not breathing correctly, then we're breathing shallow. So now we're in our fight or flight breath. And a lot of times when you put people on the table and you become the compassionate witness that wasn't there when they got traumatized. And when you hold that sacred space, they let go. And a lot of them, it's amazing how you see that breath just pop up and they start to cry and they start to let go of this stuff. And, you know, they start to learn how to breathe again. And that's a big, big thing because there's so many different traumas out there and there's so many different modalities. But if we're really not helping the person open the breath and we're trying to teach them to breathe, sometimes that doesn't work because it's deeper and they can't access the breath.
That makes a lot of sense.
So
Thank-
now, Ruth Ellen, you know my style. Now you know why I open up the breath all the time.
Yes. It's like Joe, pharmacist Ben. Here, let me join you. Pharmacist Ben, who's our Friday guest, he's always talking about breath and breathing, that we need to be better and for other reasons, but it's all connected.
Mm-hmm. Yeah, and the thing is, we want to be able to understand that it's not just one-stop shopping.
Mhm.
You know, I heard a phrase a long time ago: the trap is the method, and the method is the trap. And if I went to India and I had a spiritual experience, or I went and had an ayahuasca experience, that's one time in life, and then we try to find that again. But you may not find it. You have to find another new experience. And there's so many people out there that go, "Oh, I want that nirvana," but that's like holding on to a moldering butterfly that's sitting in a picture frame with a pin through it, and you're like, "Oh, that reminds me of my best day off," but it's dead. You know, it's
Yeah.
not alive. And you know, I say that to my clients a lot. Moldering butterflies. We hold on to these memories, but they're memories. They're not real anymore. Hopefully that makes why she has back pain. Well, if she's leaning on the bed and she does it a long time, then the spine can grow that way or lean that way like a bonsai tree. And then they can't line the spine up. So then they they can't they can't keep their chakras open. And usually the one that breaks the hardest is the heart chakra. And everybody knows that's pink, but it's also green. And the theme of that is love, grief, connection, and forgiveness. And that's a tough one, you know, because I know I was traumatized by some dysfunctional people. And I had to learn to forgive them, but more importantly, I had to forgive myself because I'm not going to ever get them to realize, oh, well, you did this to me when I was a child. How dare you? You're no longer a great parent. I'm not going to get them to say they're sorry. So what I had to do is realize, well, if I can't get them to say they're sorry, then I'll just kind of say sorry to myself. You know, and if you want to dive deeper in this, there's a great book out there by Carolyn Mays, MYSS. It's called Soul Contracts. I highly recommend people look at it because if you start looking at reincarnation, we were born into this world. We're spiritual beings having human experiences, not human beings having spiritual experiences. So therefore, we signed up for all this. So I signed up to have these people in the play of my life to traumatize me so I can be here in front of you and show up tomorrow and put people on the table and do what I do best, which is transmute pain from the suffering of my past. But a lot of this stuff I'm talking about is the heart chakra because you fear getting close. You carry unprocessed grief or betrayal. and you have a hard time receiving love or feel worthy of it. That's a heavy, heavy dose of trauma. You know, I'm sure there are people out there that I'm talking to and this is resonating with. And this one's probably one of my favorite chakras because you can see that I have this jade ring, right? You can't really see it, but a jade ring. And when I started realizing it, I started to realize that one of my biggest gifts is I've been rocked from a little child, but I still learned to love people and love life. Does anybody have any questions?
Yes, yes, there are a couple questions. All right, so Carrie B, who's here. Hi, Carrie.
Hi,
She-
Carrie.
Are there notes for the first and second chakras?
Yeah, I
And
have them. I can forward them to Ruth Ellen.
okay. And then Sherry brought a question, how does music affect the chakras?
Oh, that's okay, Ruth Ellen. I'm going to need you to help me with this, okay? Because I can get sidetracked. So help me pull
Okay,
back.
I
Okay.
will.
Music is based on what's called solfeggio waves. So every note of music is attached to a chakra. And the solfeggio waves or isochronic tones or binaural beats, they're all tuned in and tapped into that. So music is an excellent way. Like when I was a trainer and I used to box and kickbox and stuff like that, I would listen to the angriest music you could possibly hear. And then all of a sudden I would listen to Slipknot or Metallica or Venom or Slayer or Iron Maiden, whatever. And that would be my music to help me channel these lower level chakras. And then you've got the what do you call those? The chants, the Gregorian chants, and you have that's a high level frequency. So that's a higher level vibration. So that's the chakra that's probably coming up two or three from now. But music is an excellent form for us to meditate with and process stuff. So that was a really good question.
Yes, it was a very good question. And I know there's different types of sound healing as
Yep.
well.
Oh,
Which,
I forgot singing bowls. Yes, yes.
yes,
Don't want to segregate that. I fully believe in all that.
yes, it does make a difference in the vibration, like
Yeah.
all kinds of things. The tuning forks can also be used. It's really fascinating, all of the things. But and then Dave from YouTube, he would like to know, does age affect how you connect with your chakras?
Yes. There's no data on this, but as we get older, life kicks the crap out of us a lot harder. So we get more mature. So then a lot of times, you get people who have midlife crisis. You get people who want to change careers. Well, a lot of that is also based on the fact that they're trying to vibrate at a high level. And it's really sad with our society because we're taught from an early age. You get a job, you make a living, you get married, and you have kids, and then all of a sudden you're like 50 years old, and you're like, where the hell did my life go?
Mhm.
And then you start asking those questions, and then you're going, okay, well, what do I do? And I'm in the third chapter of my life, and like I said, I've had a lot of trauma, and I turned the page. I'm in a whole new chapter. So I hope this little information, I hope it helps somebody turn a chapter. But that was a great question because age does make a big difference. Because when you're younger, you're busy grinding. You can't glide.
Yes, very true. And Joanne says, very good. She's enjoying this. Oh, okay. Carry on.
Okay, thank you.
You're
All
welcome.
right. So when you start talking about the heart chakra, you start talking about the trauma held. You have death, you have loss, you have abandonment, and you have romantic betrayal. Now, I'm sure pretty much every one of us has experienced one of those. But what some people don't understand is when you have that trauma and it's held in your body, you carry a tight chest, you have shoulder pain, you have asthma, and most important, you could have heart palpitation. So when you start looking at this, your heart is the center. And if you're traumatized as a young age, and then all of a sudden you're down here in the bowels of hell, and you're sitting there and you're like, oh, I want to go up to heaven, and then you go on a trip and you go to, I don't know, you can go to Angkor Watts and you have this great experience and you're like, oh yeah, I've arrived. Well, no, you were up there for a little bit, but then you crashed down. So the whole purpose of this is, what can you do on a daily basis to keep yourself up and vibrating at a high level frequency? Does somebody have a question?
Sherry has a question of how long did it take you to get to where you are today?
Hmm. All right, I'm going to say something, and I'm not being arrogant or braggadocious, okay?
Right.
I've been doing this for 27 years, and I keep track of the hours that I've worked with people on the table. And I read a book a long time ago called The Talent Code. So if you do something 10,000 times, you become world class or very good. Whatever the universe or God wanted me to experience, I've had 87,000 hours of people on the table, not individual people, but 87,000 hours total. And I find it fascinating that if you take 7,000 of those away and you just leave at 80,000, it took me 80,000 people to get healed enough with the trauma that I had to be able to have this talk. So don't look at it as a time frame. Look at it as a responsibility that you have. Because remember, I told you, you can only control from your fingertips backwards. So if you're waiting for somebody to save you, it's not going to happen. There'll be people like me and others who will get you ready for it, but you've got to take the step.
Yes, I was actually watching something this morning that said those same words, that you have to save yourself and
Mhm.
that you should not be sorry for saving yourself, because you have to. No one is going to come and save you and protect you and all that things that people think that is going to happen. And when you work with people, um, based on my experience with you,
Mhm.
like we'll be working, and especially like in my heart chakra area, there's been a lot of trauma there over the last
Oh,
several years.
yep.
It's not even
Yes, sir.
um and um things will come up when you touch a certain spot,
Mhm.
and it's an opportunity for a person, me, to,
Mhm.
well, first there's a moment of reliving the trauma.
Mhm.
And then there's a moment of saying, and I've learned this working with you for, I think, since 2018.
Yeah.
Yeah. It can be really big sometimes. And I had to realize that it wasn't real anymore.
Nope.
And we went through this whole thing.
Yeah, I know. I know.
Freaking out and
Yes.
panicking, and you're like, it's okay, and just breathe. And where are you? And that, and then I start saying it's not real. And it became a pattern for me to say, this is not real. That happened. Yes, I need to acknowledge that that happened, but it's not real right here on
Right.
this day at 3:39 p.m. It's not real anymore. And, you know, the heart palpitations and everything that you were talking about, like
You went through it all.
I went through it all. Everything that you talked about with that, I did.
You
And
know,
I
can you just keep me on track? I'm just going to segue a little bit.
got it.
Okay. When when I have my clients on the table and I tell the therapists that work at Rooted Somatics, you know, and I give them this insight and they always come back and say that really meant a lot. You can't step twice in the same river. So if I'm going back into a memory, that memory's over. Like that event never happened, you know, in the present. It happened in the past. So if everybody out there who is suffering from depression or, you know, trauma, I just want you to try a technique that I heard a long time ago, probably when I was 13 going through therapy. Imagine you're in a movie theater and you're wearing a big fuzzy sweater and you're sitting in the front row and you got your popcorn, you got your Coke or whatever, and you're looking at the screen. It's so in front of you. And all of a sudden, these fish hooks fly around the outside of the screen. Well, if you get too close, you get pulled in. That's your primal brain. So if you just use your logical brain and go, well, wait a minute, I'm here in my bedroom and I'm safe. And you tell your logical brain, pull me out, and you go 5 rows back, those fish hooks will never grab you again. And that's what Ruth Ellen is talking about. I helped her realize that, you know, and I help a lot of people. And I hope that information helps therapists out there who are listening to this because that's the simple truth. The past is the past. The best thing about the past, it's over. We're the ones that keep opening up the scabs and ripping open the wounds and going, ooh, I've got to dive into this. Well, you might, but understand you're safe. Okay.
Yes.
So any questions?
Now, Elise, though, she has a comment,
Okay.
and I'm going to exaggerate it for her.
Okay.
Please come to California. But at least you can schedule an appointment with Tim and come out here and visit us. And
Yeah, or you know what, if Elise wants to, during COVID, I did virtual sessions, you know. You were
okay.
part of them, you dealt with them, but yeah, I mean, I wouldn't just leave her hanging. I would give her my information and say, give me a call, let's talk.
Okay. And she says she just made you that.
All
Thank you.
right.
All right. Carry on.
All right. So I left off with the heart chakra. All right. Now we got the throat chakra. This one gets everybody choked up. I know it's bad, but the color's sky or blue, and that's our throat chakra. So this one for me was a major, major player in getting over my trauma because I gave all the people in my life control over me. So I didn't have a voice. I had no voice at all. I was raised by a narcissist and I was pushed into a cave and I became the crack in the back of the cave. And a crack can't have a voice, it can't have an opinion. So my throat chakra locked down. And it was really hard for me because you silence yourself and you're fearful of speaking your truth. You over explain and avoid contact. That was one of my major, major problems before. And you carry guilt for what wasn't said. And I'm sure a lot of you out there, that'll resonate with you big time. But what are the traumas of that? Verbal abuse. God knows I've had that in spades. Being told to shut up, same thing. And secrets or forced silence. So if you have those, you're going to experience physical symptoms like chronic sore throat, TMJ or jaw pain, or neck stiffness, or trap tightness. So, you know, when you don't speak your truth, or you don't speak the the truth of what happened to you, it's going to stay. And one of the things from a very traumatic childhood is I have horse teeth, because I used to grind my teeth in sleep, and they're so flat. I stopped, but you can imagine the TMJ and the masseter muscles and the small little intrinsic muscles of your jaw and your neck. So if there's people out there that have TMJ, there's a lot of times I'm working with them, or I'm working with them in conjunction with their dentist, and we crack open, and all of a sudden they start to talk, and they don't grind their teeth. And it's something that I've noticed. And even what I said before about the amount of hours I've had on the table, I mean, there are people who looked at me and said, "Oh, you're lying," but it took guts for me to tell you that. But it's the truth, and those people who know me know it's the truth. So, when you start to learn how to express your voice, you start learning boundaries. And there's a lot of people out there who give their boundaries away for safety, but they're safe, but they're not thriving. Anybody have any questions?
That is a very true statement right there.
Mm-hmm.
It's huge. It's huge. Yes. Carrie said, Carrie B. Uh-oh. Would this be evident with children with tonsillitis, like chronic tonsillitis? I'm thinking.
It's interesting you brought that up, because I had sinus problems and tonsil issues probably until I was 17, and I had my tonsils taken out. But I would say that if we reverse engineer the chakras and we start looking at the lymphatic system, if we look at the lymphatic ducts of our neck, they're the tonsils, right? So yeah, I mean, if we're walking around and we have trauma hit us, yeah, I mean, they could be blocked up, especially if they've been through an ENT and they've looked for everything else. Then a lot of times, children especially, how they're tight up here. A lot of times when you get somebody like me, or a good massage therapist, deep tissue person, you can release the neck muscles, release the shoulder muscles, and then you can start to get the nervous system to relax and stop overproducing histamine, or that inflammatory marker for, foreign bodies, or, cellular waste and stuff like that.
Right. That makes sense. And then Verna would like to know what practice needs to be done to help throat chakra.
Well, what you've got to do is you've got to get the ability to understand that your voice matters. You probably have been conditioned to shut up, be quiet, not have an opinion. And that's a hard one to get, but I've had people have success by going outside in the woods and singing. I've had people who have written deceased individuals' letters, and then they read the letters out loud. and then they burn them, because what they're doing is getting the poison out. You don't die by the snake bite, you die by the poison. Another way is what we talked about before with sound therapy. You can take music, and you can take a what do they call it, a tuning fork, and you can get the right frequency, and you can put it on your jaw or your chest or something around there. Another one I like to do is I take my own lymphatic draining, and I scrape my clavicles and get my lymphatic system open. But if you're trying to open up your throat chakra, you have to understand, you have to go back down. You have to start working on your sacral chakra and your root chakra, because they're also part of the dysfunction.
Mm.
It's never one chakra. It's never one thing. It's always two or three. There's no such thing as one dog, one. There's always two or three or four. So don't look at it as the fifth chakra. Look at it as a whole.
Thank you. And you may continue there. I don't have any more questions at this moment.
Okay. So now the big one, the third eye chakra. This color is indigo. What means it's intuition, it's insight, it's self-trust, it's clarity. So all of you who read Eat, Pray, Love, and it resonated with you, that resonated with you because it was talking to your third chakra. Those of you who went to the Bahamas and had a beautiful experience, and then you came across a shaman or something like that, that's your third chakra. That is your intuition. And when that's blocked, you can't hear the universe or God or whoever, whatever. You can't hear it because you got the noise of all the other chakras drowning it out. So when this is blocked, you second guess your intuition. You say, oh, you know what? I have this really good intuition about, I don't know, this job. And you're like, well, maybe, you know. And then what you do is you wind up getting in your own way. So you second guess your intuition. You feel mentally foggy or confused, and you're afraid to see the truth. And my life didn't change until I went to India and I had a spiritual experience on the Ganges, where I saw the reason that I was traumatized is to be here right now and to be who I am. And instead of being gaslighted or, brainwashed by religious dogma or betrayal of inner knowing, you know what I mean? So anybody have a question? I think I see somebody there.
No, I don't see anything.
Oh, okay, my fault.
Not your
So
fault.
anyway, you got the trauma held.
Marilyn is
You have to
typing what you say, so
Okay.
they're going to keep coming up.
Maybe that's it. Maybe
Otherwise,
that's it.
Verna said thank you.
Okay, great. Glad to help. So the trauma held in the third eye is gaslighting. God knows I've been through that my whole entire life. Religious dogma. Oh, you can't do what you need to do because it doesn't fit with your religion. But the way I look at it, and I tell my clients, we're all here on a round planet. How come sometimes we have square religious values? I mean, we're all part of the same thing. If you cut me, I'm red. If I go to Africa and I cut somebody, they're red. If I go down to, if I go to Asia or I go to Iran, or whatever, they're all red because we're all part of the same thing. So when you start looking at the religious dogma, you go, oh, okay, well, I can't do that because I was told I can't. Well, maybe you want to look at that. And the physical symptoms, this one's important for all people who have migraines. They have vision problems, provided you went through all the different channels and all your tests came back. one of the biggest physical symptoms of the third eye chakra being blocked is headaches, sinus pressure, vision problems, and nightmares. So this one, I had a long time with headaches until I started working on myself, and I stopped being afraid of being intuitive. And I stopped being afraid of who I am, what I am, or whatever people want to call me. Because a lot of that is the tension inside our head is linked to the nervous system, the hormonal system, and the adrenal system, but it's also linked to the lower chakras and all kinds of stuff. So, you start to see that, you look at where the symptom is in our body, and chances are there's going to be some correlation with something that happened in your life on that chakra level. Okay. Last chakra, the crown chakra. Oh, go
Marilyn
ahead.
has
What?
a question.
Okay.
Marilyn, I'm going to add her spotlight. Marilyn, if you want to unmute.
Now, I've been in yoga classes and they practice meditation,
Mhm.
and they'll say to focus on the pineal gland, and I can actually see a white. When I close my eyes, I can actually see a white dot. It's like a pea, size of a pea, and it's surrounded with purple indigo, like clouds. So
Yes.
what does that mean then if I can see that?
What that means is your third eye's open.
Hmm.
And a lot of times people who aren't open, their diet gets in the way. There's some strong evidence that chlorine in our water affects the pineal gland. And when you look at the pineal gland, you look at this, it almost looks like an acorn. And a lot of times that acorn gets blocked by our diet and all the stuff we're talking about, and we're not able to process light. But what's really interesting is the pineal gland is linked to our melatonin levels. So now you're starting to talk light. So, it took me a long time to get mine open, but that's because pretty much all my chakras are blocked, and I just all kinds of stuff. But if you're seeing a white light and you're seeing purple, hell, if you're seeing yellow, you're still feeling something, right? It's just purple is the epitome of all the different colors. But that just proves that you're open. So that's awesome. Keep
Okay,
doing it and make the dot a little bigger. Start practicing on
it does. It gets
stretching the
bigger.
back.
It
Yeah.
does.
And then start taking that ball of energy and wrapping it around your body, and really start to have fun with that. That's when it gets really cool. You take this little dot and it goes bigger, and then it gets about the size of your head, and you're like, okay, now I'm going to push it through my whole entire body.
Fascinating. Thank you.
It's pretty cool.
It is. Thank you.
Thank
All
you.
right, so the dysfunction when it's blocked, life feels meaningless. You feel cut out from the purpose of the divine love, and you have existential despair or spiritual dislocation. So that's a lot of times when people come on my table, they say, you know what, Tim? I feel like a man or a woman without a country. And then when they say something like that, or if I'm working with a wounded vet that just came back from Iraq or Iran or whatever, and he wasn't treated the right way, he wasn't very slowly reintroduced. But what they do is say, okay, thank you for your service and have a nice life. And then all of a sudden, they're these warriors that are told to kill and to beat up and to protect. But without that identity, and they're no longer in the service, who are they? So with the crown chakra blocked, you feel cut off. And obviously that's the higher level, God, universe, you know, prana, however you want to call it. But the trauma held with that is religious rejection, spiritual betrayal, and depression or soul loss. And this is an interesting one. When you have physical symptoms of that, you have migraines, sleep disturbances, and feeling numb or disconnected from the self. So a lot of times when people have sleep disturbances, they're like, why am I waking up at 3 o'clock? Well, if you go into spirituality, you realize that 3 o'clock to 5 o'clock in the morning is that divine hour. And a lot of times it's the only time we have peace because nobody wants something from us. So when we wake up, what I tell people is pull out a journal, write down your thoughts, and then don't be surprised if you start getting answers from the universe or God or whatever to solve your problems because you weren't meant to sleep through that awakening. Any questions before I wrap it up?
I don't see any anywhere.
Okay. All right. So what I wanted to do is I wanted to finish up by saying every chakra is a door. Behind each door is a part of your story waiting to be witnessed. Your body isn't betraying you, it's protecting you, storing what couldn't be felt at the time. And the work that I do and what a lot of all these Reiki people that you know are friends and family, what we do, we create enough safety for those doors to open up again. So if something stirred in you today, don't push it away. Breathe into it, listen, let your body speak. You're not too late, you're not too broken, and nothing is stuck to heal. So thank you very much.
Thank you. I always love it when you're on. It was amazing.
It was fun.
Yeah,
I hope it helps some people.
I hope so too. And when you're out there and you're moving, if an emotion comes up or a thought, just breathe through it and allow it. Because like when I started doing yoga, like you said, go do yoga. And
Oh,
so,
yeah, I know which one you're talking. Okay, go ahead, share. Sharing's
yeah.
caring. Go ahead.
And I would do certain movements and involving my hips, and I would just start crying, like bawling. And fortunately, that yoga instructor was a friend of mine. And she would just kind of be like, if something comes up, just breathe through it, allow it to go through your mind and let it pass. Well, 5 minutes later, I'm still crying, but I'm still doing the movements. But I released a lot of pent up trauma and made space for a good energy.
I think that's the key thing is making space. Like if you practice Shawshank Redemption and walk around the prison yard and drop off your little rocks because you're trying to dig a hole out of the cell, every time you drop off rocks, you create space. Make sure that that space gets filled with something other than the rocks that you took away.
Yes, it's very important. Thank you so much. Let me see what just came in. Oh, okay. All right. So thank you so much, Tim. And how can people get a hold of you? Because it changed from what we had prior.
Oh, you can just get on rootedsomatics.com
Okay.
and leave a message. You can get on Facebook, look up Rooted Somatics Facebook page and leave a message. There's so many different ways. And I'm sure you put the business phone number up.
I did not because
Oh, I'm sorry.
Marilyn's the one that does all the typing when I'm doing this. Otherwise, I'd not follow. So if you want to tell
But
us.
anyway, nobody's out there that they can get a hold of me. So if this resonated with you and you want to talk and you want to set up a session, we can do it virtually. And also the other thing is I find therapists in your area that when I talk to them, I interview them, and I can help you find a therapist in your area that can help you.
Would you like to give the phone number? Or would you prefer it just be in Zoom?
Oh, just put it on the site. Put
Okay.
it in Zoom. Put it in Zoom.
All right. All right. I will do that. I have to look it up. So keep talking for a second while I look it up. I don't know if I are. And it's the number I call, correct?
Yes.
She gets all the calls. Okay.
All the funnel, they all go to Melissa.
Okay. So that phone number is 215. Oh, I'll put it in here. Sorry. Sorry, I almost did that what I didn't want to do. Because I know we don't want like
Yeah.
eh,
There's a reason why I changed my phone number. That's why.
yes, there you go. So it is in the Zoom chat. Hattie. And I posted it for everyone. And Marilyn, if you could make a copy of that for future reference, that would be awesome. So it's 6 minutes after 4. So if all my co-hosts could come up and join us, and then we'll wrap it up. Thank you so much, Tim. And I look
That was
forward.
fun.
Yeah, it's fun. And I look forward to you coming back on again. And okay. And goodness, I guess AJ usually spotlights everyone. So all right. And then that's all of us, right? For today. Oh, more visible. All righty. Thank you so much, Tim. Again,
No problem.
if you want to get a hold of him, look up rootedsomatics.com and Rooted Somatics Facebook page, and schedule an appointment with them. He is not in Philadelphia. He is out of Springhouse, Pennsylvania now, and has a beautiful office. Tell us a little bit about the different practitioners that you have at this moment that work with you, real quick.
Yeah, I mean, all the practitioners that work at Rooted are all clients of mine that I've helped pull out of trauma. And with no coaxing on my behalf, I sat there and waited, and I had a feeling, and then they would say, well, I would love to be part of this tribe. And so we have a chiropractor, we have a lymphatic draining specialist, we have a yoga and Reiki master who is one of my students, and she's fantastic. We do a lot of combination of yoga and what I do at the same time.
Oh.
We have one practitioner who's a yoga person who also is a licensed clinical social worker. And we are now going to start doing sessions where she talks to the people and I stay quiet and work on their trauma.
Nice. I like the sound of that. I like
Yeah, it's just creating a whole different paradigm instead of everybody staying in their silos. It happened in Boston. I worked with a psychotherapist, and we had a woman who had that fear of going outside. I think it's agoraphobia. And I worked with the psychotherapist and the client. And believe it or not, that first session, she was able to walk out the front door and go down the stairs.
Nice. That's really great. And thank you, Bruce. Bruce says, great show, Ruth Ellen and William.
Thank you.
Thank you. Thank you. And then you also have a lady who does facial massage now.
Yeah, we have a therapist who is a triple licensed massage therapist,
Awesome.
and she specializes in doing facials,
Mhm.
and she specializes in doing deep tissue. But the one that she recently got licensed for is called buccal massage, and that's a massage that not many people know in the US. And that's where she realigns the muscles of your face and your jaw and your neck. And so far, I have not had anybody come out that's not blissed out and super happy.
Yeah, she did that with Jesus,
Yeah. And
and
the
he
thing is,
loves it. He
I'm
loves
so
it.
proud to have these people,
Yeah.
because we're changing the whole paradigm of
Mhm.
what holistic means.
Right. That's excellent. All right, so we're going to go to Phyllis because I know you probably have to jump off quickly. Phyllis is magnificent and she helps Marilyn with the chat, and she helps out on all the different platforms, um, doing the disclaimers and bringing in questions. And she is just a godsend. And thank you so much for all that you do. And then we have Marilyn Speedy Fingers, who is doing all the dictation in the chat, pretty much every word that Tim says. And I don't know how she does it, but she still looks things up and puts the definition of it and almost doesn't miss a beat. So thank you, Marilyn. And then we have Sherry, who is the production assistant and also a co-host, and she helps with setting things up. So what I send to her, she puts out onto the different platforms. And thank God for all of you. They were a little short-handed today, so it's a little different. And and then we have Albert, and Albert is in South Africa, and he is letting people into the Zoom, changing names, and modifying the telephone numbers so that you all call in. You have privacy. Your whole phone number isn't shown to everyone. And he also is part of our phone team and opens it in the evening. In fact, everybody on here is part of the phone team or the email team or both. So thank you for answering the phone in the middle of the night. My name is Ruth Ellen Sanchez. I am the executive production manager of the Daily with Doc and Becca show. And I'm so grateful for you all. And this program was not meant to treat, diagnose, or cure any diseases. It was for educational purposes only. And thank you for being here. If you want to talk to a certified holistic health coach, you can call our hotline at 855-949-3377. And if you have questions that didn't get answered, or if you have questions that were not on this topic, please email us at questions@dailywithdoc.com, and somebody will get back to you. Please include your phone number if you're emailing us, or if you're calling and you leave a voicemail, make sure you leave your phone number, so that, especially for email, so that we don't have to email you and say, what is your phone number? Because, it can take 2 days to talk to you on email and 20 minutes to an hour by phone. And it just cuts the time down in half, and you get a more immediate response. And let's see, I don't think I forgot anything. And tomorrow we have Dr. Randy Shannon on, and it'll be her first time on Daily with Doc and Becca. So we're really looking forward to that. And as always, be kind. You have no idea what somebody is going through. You just, they may be smiling and happy and looking like they're all together and everything is great on the outside, out in public, and they can be dying inside and in severe pain or something. So be kind, smile, and be patient. Be patient, people. Anyway, thank you so much, everyone, for joining
Bye,
us.
everybody.
See you tomorrow. Bye-bye.
Welcome to Daily with Doc and Becca. This program is for educational purposes only. The statements in this program have not been evaluated by the FDA. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. Testimonials are shared as individual experiences of the individual sharing their testimony. Results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.